Today I want to talk about aneurysm of the brain. Not too many people know about this, but we should. We've all heard of people who had an aneurysm, sometimes a ruptured, unruptured, a leaking aneurysm in the brain, which can lead to a hemorrhagic stroke, sometimes instant death, sometimes death after a few days. We need to understand this because there are many risk factors that we need to take care of. Number one, what is an aneurysm? An aneurysm, also known as a cerebral aneurysm or an intracranial aneurysm. We have blood vessels in our brain. Let me try to make it as simple as possible. Think of a bulge or a little balloon in that blood vessel. As the blood flows through our blood vessels, if there are weaker parts of our blood vessel, that's where the problem is. This little balloon can form, this little bulge can form. And if we have an interruption in blood flow in the brain, like you have in the heart, you know how bad that can be for you. Now, why does this happen? We're going to understand there are three types of aneurysms, but we're going to jump right into the risk factors. How do you identify? Someone could have a ruptured aneurysm or a unruptured aneurysm, or even a leaking aneurysm in their brain. And these are some of the symptoms you want to watch out for. A terrible, terrible headache like you've never experienced before. A severe, sudden headache could be a sign of an aneurysm in your brain. Could be ruptured, could be unruptured, could be leaking. Okay, people describe it as a headache that they've never experienced in their life. It can come suddenly, it could stay for a couple of days, weeks, which is why if it stays for a longer time, you want to get yourself checked up. Don't assume it's just a migraine. You would know the difference in this kind of headache. But there are other symptoms that you can correlate this with. Besides the severe sudden headache that you could have nausea, you could have vomiting, your neck could get really, really stiff around here. You could have a blurred vision or a double vision. There would be a sudden sensitivity to light. You could have a slight seizure as well. Drooping eyelids, one drooping eyelid or both drooping eyelids. A sudden loss of consciousness or brain fog, sudden confusion. You could have one or many of this. The idea is prevention is always better than cure. So if you notice this happening to yourself or someone else, you want to try to correlate these symptoms. And what you want to do is get straight to the hospital. Because the earlier you get to a hospital, you can actually save your life. What happens is, in an unruptured and a ruptured, there's a big difference. In a leaking aneurysm, there could be blood that's slowly leaking out of that damaged blood vessel. In short, an aneurysm is nothing but weakened blood vessels. Now we have blood vessels running across the network of our body. The job is to supply blood and oxygen to trillions of cells in the human body. Over time, these blood vessels weaken because of poor lifestyle, and we call it a whole load of other issues that cause it. Within each blood vessel, we have an endothelium, an endothelial lining. Over time, these endothelial linings start to get more and more damaged. So for example, in the heart, when your endothelial lining gets damaged, it forms like a little dent, and that can fill up with plaque, and that builds a blockage. Endothelial linings can self-repair themselves when you have the right environment within you, outside of you, and the right nutrients to help you repair the endothelial lining. So first, what are the risk factors? Smoking. You got to quit smoking. Number two, heavy alcohol, binge drinking alcohol, especially alcohol and smoking together makes it even more dangerous for all the blood vessels. It may not have to just be an aneurysm, but if you've had a previous aneurysm and it's sorted out, you need to stop smoking and stop heavy drinking, or probably just stop drinking completely. Heavy intake of leisure drugs, of non-regulated drugs can also lead to aneurysms. High blood pressure, which is not monitored. Or people have high blood pressure, they forget to take their medication. Now, as you know, your blood flow through your vessel, if the pressure builds up too much and you have a weakened vessel, you can picture what's going to happen, whether it's your heart or whether it's your brain. Polycystic kidney disease. If you have polycystic kidney disease, please ask your doctor about the risk factors and what you need to do. You also need to change your lifestyle because you can prevent the aneurysm from happening, especially if you have a polycystic kidney disease with lifestyle changes. Inherited connective tissue disorders. If you have that problem, you want to just be aware that you should have the least of these risk factors. And of course, if you have a family history, that's a problem. So let's get straight into solution mode. Number one, if you have a high blood pressure problem, number one, you should plant a seed in your head that, hey, it can be reversed with lifestyle changes. Don't get off your medication. Let your doctor wean you off your medication as your systolic and diastolic start to fall into place because you're making lifestyle changes. Never get off your medication. If you have a high blood pressure problem, you want to stay on your medication, make lifestyle changes, show your doctor that with your lifestyle changes and nutrition, your pressure's coming down and he or she will reduce your medication. But never stop it, because sometimes you have silent attacks of high blood pressure, and that could create extreme damage in your blood vessels all across your body, your heart, and your brain. Throbbing headaches. If you have throbbing headaches, you have these aches that go around, go and get your pressure checked. That could be a sign of high blood pressure and you want to take preventive action. Vitamins that are great for your blood vessels. Vitamin C, vitamin E, the entire spectrum of B vitamins, and foods that are rich in flavonoids, which we'll come to. Exercise by default. Your blood vessels grow stronger when you exercise. More blood flow, your VEGF, which is your vascular endothelial growth factor, everything behaves the way it is supposed to behave. Anti-inflammatory foods. You do not want to have uncontrolled inflammation in your cells and in your blood vessels. Sleep. There is a direct correlation between sleep deprivation, ruptured and unruptured aneurysms. And we see this all the time. Sleep deprivation, people pushing it. Sleep deprivation night after night. What do you think is going to get affected? The human body, your blood vessels, your heart. There is a direct correlation between sleep deprivation and the health of your blood vessels. You want to eat a diet that's rich in vasodilators and flavonoids, like I mentioned. What are vasodilators? Foods that basically relax your blood vessels. They expand them, they relax them so they can expand easily, contract and expand again. You don't want your blood vessels hardening and becoming more and more narrow, which will become a blood pressure problem, and weaker blood vessels internally. Damaged endothelial linings leading to the same problem that we discussed. So what are some of the foods that are beautiful, natural vasodilators? Pomegranate, spinach, beetroot, onion, cinnamon, the Ceylon rolled cinnamon, not the Chinese, not the Japanese. Garlic, turmeric, fatty fish, omega-3s, ginger, all of the berry family, cooked tomatoes, and 70% and above dark chocolate. These are vasodilators that you should have in your diet irrespective, because the health of your blood vessels is everything when it comes to human health. Then, managing stress. When we get stressed out, cortisol goes up, adrenaline goes up, there's a complete change in our hormonal balance, and we know stress, chronic stress, has a direct impact on our heart, our brain, and our blood flow and our blood vessels. We spoke about sleep deprivation and even sleep apnea. It is so important for you to diagnose if you have sleep apnea. You want to make sure that you get checked for sleep apnea. So if you have a problem, you can get it treated. You can use a CPAP machine as per your doctor's advice, and you can reduce the risk factors of an aneurysm. Magnesium. Magnesium is required for endothelial function in every way. Where will you find magnesium if you're not supplementing it? You find it in green leafy vegetables, nuts, seeds, dark chocolate, avocados, all of the bean family, spinach, pumpkin seeds, and chia seeds, almonds, and walnuts. And finally, the endothelium that I'm talking about. There are foods that are also great for your endothelial lining. These foods have a positive impact on your VEGF, your vascular endothelial growth factor, that signals when to grow and when to stop growing, which is extremely important. It plays a role in cancers, tumors, and also the health of your blood vessels and your heart and your brain. Now, these foods would be cacao, raw cacao, so good quality raw chocolate, black tea, black coffee, black, remember I said black tea, black coffee, your fruits, your seeds, foods rich in antioxidants, L-arginine, pumpkin, and beans. So you see, all the foods I mentioned are common foods. You need this, whether you're a heart patient, you have a family history of heart problems, brain hemorrhages, aneurysms. If you don't have any of these problems too, this is what your blood vessels need. With damaged blood vessels, we can die. With damaged blood vessels, we have extreme problems. And all the foods that I mentioned, they're common to each other. They're all vasodilators. They're all filled with magnesium. They're all great for your endothelial lining. And that is the beauty of nature. It gives us these little foods that have commonalities between all of them so that we don't have to have a stack of nutraceuticals and vitamins and minerals that make claims for better health. But in most cases, they don't. First preference, natural food. Second, supplements if you need it. Have a great day, everyone. Eat smart, move more, sleep right, breathe deep. And remember, you care. It's all about you.